The role of technology in the medication use process. Due to the numerous steps and required in the care of the healthcare industry, is an inherently error-prone process that is fraught with the mistake to occur. This concept was confirmed in the oft-quoted 1999 Institute of Medicine (IOM) report to ERR is Human, Building and Suffer Health. Technology and healthcare primary use of data input to increase each department's efficiency with the financial accountability measures. Influence of the adoption of technology, GCHO, Joint Commissions and Accreditation of Healthcare Organization and National Quality Forum are present to refraining from uniformly requires its adoption. V is the only healthcare system that has fully adopted bar coding technology computerized prescribe order entry CPOA, a system used to direct entry of one more types of medical orders by prescribe into system that transmit those orders electronically to the appropriate department. Medication administered level. Record MERS derived from one system which does not correlate with the other, lead to discrepancies in medication profile as well as possible loss of double check between drugs distribution and administration if electronic MERS come from CPOA and not from pharmacy order entry system medication errors such as wrong PT errors, wrong drugs errors when the medication is selected from list due to look alike similarity in either brand or generic name or order intended from laboratory levels.
Technology and healthcare. The majorities of technology acquisition have consisted of basic standalone computer systems, which were primarily used for data input or increase each department's efficiency with financial accountability resources. These measures were generally installed in the pharmacy, radiology, and laboratory departments and could also be found in the administration and business offices. Computerized prescriber order entry or CPOA studies have shown that as a result of poor handwriting, 50% of all writing physician orders require extra time to interpret. 16% of physician has eligible handwriting. Eligible handwriting of medication order has been shown to be common cause of prescribing errors and patient injury and they have actually resulted from such errors. The use of CPO system has the potential to alleviate many of these problems. CPOA can be defined as a system used for direct entry of one more types of medical orders by a prescriber into a system that transmit these orders by electronically to the appropriate department.
Hi, good morning. I am Perky Joy Digal Elliott, and I will be reporting the influences on the adoption of technology. Consumers have become increasingly concerned that hospitals are less than safe following the numerous mass media reporting of medical mistakes, which have resulted in patient harm and deaths. In 1995, there were television and newspaper accounts that reported the tragic death of patients from a preventable adverse drug event due to an inadvertent administration of a massive overdose of a chemotherapy agent over 4 days. According to a 1992 American Medical Association report, medication errors related to the misinterpretation of physicians' prescription were the second most prevalent and expensive claims, less on the malpractice cases filed over a 7-year period in 1992. Other potential enhancements that even a basic CPOA system could offer to further enhance and medications or ordering practices, including features unique to the acute care setting, ambulatory care setting, or both. Allow for prescribers to access records and enter orders from their office or home. Prescribers, selectable standardized single order or order set. Implementations of organizations' specific standing orders based on specific situations such as before or after procedures. Passer feedback system that present patient-specific data in an organized fashion such as test results, charges, materials, and progress notes or active feedback system.
Inaldo Jacqueline L. So, Barcode enabled point of the care technology for more than 20 years. Barcode technology has clearly demonstrated its power to greatly improve productivity and accuracy in the identification of products in a variety of business settings, such as supermarket and department store. One study noted 5 significant negative effects that occurred during the implementation of a PBOC system. First is nurses were sometimes caught off guard by the program automated actions taken by the PBOC software. Second is the PBOC seemed to inhibit the coordination of the patient information between prescribers and nurses when compared to a traditional paper-based system. Third is nurses found it more difficult to deviate from the routine medication administration sequence with the PBOC system. Fourth is nurses felt that their main priority was the timeliness of medication administration because PBOC required nurses to type in an explanation when medication were given even a few minutes late. Then last, nurses used strategies to efficiency that circumvented the intended use of PBOC.
New types of medication errors. First is omission. After the patient's barcode, armband, and medication have been scanned, the dose is inadvertently dropped onto the floor. Next is extra dose, may be given when there are orders from the same drug to be administered by a different route. And the wrong drug, in situation when the nurse administers a medication which has not been labeled with a barcode. And the wrong dose, in situation when the nurse has difficulty in scanning medication and proceeds to scan the medication twice. Unauthorized drug, an order to hold the medication unless a lab value is at a certain level such as aminoglycoside. Charting errors distinguish the indication for the administration of the medication. Next is wrong dosage form. Certain drug shortages may be forced a pharmacy to dispense a different strength or concentration other than what is entered in the BPOC software.
Automated dispensing cabinets is a computerized points-of-use medications management system that is designed to replace or support a traditional unit dose drug delivery system. Wide acceptance of ADCs are the following: improving pharmacy productivity, improving nursing productivity, reducing costs, improving charge capture, enhancing patients' quality and safety. Unsafe practices with the use of ADC, the lack of pharmacy screening, medication order prior to administration, choose the wrong medications from an alphabetic list. Common contributing factor in medications error arising from medication name that look alike high alert medication, place stored and return the EDCs are problematic storage of medication with look alike name and or packaging. The EDCs are computerized points of use medications management system that is designed to replace or support the traditional unit dose drug delivery system. Many healthcare facilities have replaced medications cart or open unit stock system with EDCS. The rationale behind the wide acceptance of this technology are the following: improving pharmacy productivity,
reduce the number of steps from filling each patient's individual medication bins to filling a centralized station, and then improving nursing productivity. The time spent gathering or obtaining missing medications can be reduced. Under reducing cost, increased pharmacists and nursing productivity, which frees them from the consuming processes and allowing more time for patient and clinical interactions. And then improving charge capture, addresses that are interfaced with the accounting department allow for the captures of all patients' charges associated with administered medications, and then enhancing patients' quality and safety. LCS that have built in the station support system that warn users on drug interactions, drug allergy interactions. Example of high alert medications stored in automated dispensing cabinets. Class category of medications: adrenergic agonist, and then adrenergic antagonist, anesthesia agents, hypoglycemic oral, radio contrast agents, or IV. Specific medications: IV amiodarone, colchicine injection, heparin low molecular weight injection, insulin subcutaneous and IV, magnesium sulfate injection.
Smart infusion pump delivery system infusion pumps with dose calculation software, sometimes referred to as smart pumps, could reduce medication errors, improve workflow, and provide a few sources of data for continuous quality improvement by identifying and correcting pump programming errors. Infusion pumps dosage calculation software used in the administration of parenteral medication through IV lines. Medication are administered based on a calculation of a volume to be infused per hour of delivery. Aim: reduce medication errors, improve workflow, and provide a new source of data for continuous quality improvement. Benefits: maximum flexibility, increasing application to different areas of the hospital, applicability of the infusion pump regardless of patient's condition, age, and gender. Improvement of patient care, minimizing human memory created error. Smart infusion pump, single wrong entry or button press, nurse's wrong programming of the dosage, high implementation cost. Features: it increases accountability and capture of charges for items, up-to-date drug reference information from online medication reference libraries, customizable comments or alerts, and reminders of important clinical action that need to be taken when administering certain